Dr. Alex, can you tell us where we are and what's going on here with this new building?
All right, so currently we are standing in front of the neonatal intensive care unit of Hope Christian Hospital, subsidiary of Village of Hope. This is a project that is partly funded by Dreams for Orphans, which is an NGO in the US who wanted to care for abandoned babies so they could receive some health care too. And so we have been partners in this building so that we can take care of neonates who become sick shortly after birth.
I see. And Dr. Alex, what is the success rate for babies, especially those that are born premature, and what would happen to them if there was not a place like this to be able to bring them?
Well, the fact is, worldwide, about 15 million babies are born premature, and about two-thirds of these occurs in sub-Saharan Africa. And the outcome, obviously, is worse. Whilst about 90% of children who are born premature in the Western world get some form of help, in Africa it is far less. Even for those who are born between 32 and 37 weeks, their chances of survival is only about 60%. Whilst in the United States, about 90 or 95% of children who are born less than 28 weeks even survive. And so that makes our situation pretty bad. And that is why this initiative, we think, is very laudable, and we may need more hands to help the children.
And Dr. Alex, what else can be done for mothers as they come in and as they are having struggles that will be able to be taken care of at this facility?
So this facility also has a place for the mothers of the babies who will be admitted here. And so for proximity, so that they could breastfeed their babies or express breast milk for the nurses to feed their babies with, it is important we provide a place for them. And so this building also contains that aspect of the healthcare. So mothers can be close to their babies whilst they are on admission. And then again, we have one other aspect of this building, which is the domestic aspect of it. Like I initially said, Dream for Orphans wanted to take care of abandoned babies. And so once they bring them in and we take care of them health-wise, when they are born, we need to get a place for them to stay until the government comes in to take care of them, or we adopt them, or they are integrated into the main Village of Hope stream.
Awesome. And what equipment is still needed to make sure that this facility can be completely and well functioning?
Research found that for most of the deaths that occur in early neonatal death, especially for the premature babies, it is for lack of warmers. So if we have enough warmers, including incubators, heat lamps, that can keep the babies warm, and have some infusion pumps that can deliver the required amount of fluid to take care of these babies, the survival rate is going to increase. And so for us to start operations, we will definitely need incubators, we will need some warmers, we will need some monitors for the babies, we will definitely need infusion pumps to get them some infusions when they require it.
And how far would people need to travel to go to find a facility that can take care of babies like this, if not for this community? And how many are there in Ghana?
In Ghana, there are only a few neonatal intensive care units. Currently, there is one at Kolebu, which is a teaching hospital, and there's one at Kumasi, which is also a teaching hospital. There is some form of special babies unit at Cape Coast, which is about 2.5 hours from here. But that is not up to scratch like those in Kolebu and Kumasi. And so in the country, there are about just 3 or 5 up to standard neonatal intensive care units. And so we believe that we can bridge the gap by establishing this and making sure that it is well equipped to serve the purpose for which it was built.
Awesome. And Alex, from your own perspective, being a doctor and being from Ghana, what does this mean to you, and how did you decide that you wanted to do this and stay here?
Well, during my medical school days, I have always wished to stay in Ghana and help, my people. Obviously, there are greener pastures out there, but I feel people also need care here. And so it has always been my wish to do something to make a change in the lives of people. And I have always liked working in the rural areas where I probably identify with. I grew up in a rural area and I know the kind of struggles they go through in accessing healthcare. And so becoming a medical officer, I felt that the need was more in the rural areas. And then people may have to travel long distances to access healthcare, and especially so for newborn babies. And so if we have this facility here, it is going to be awesome. It will serve a lot of people coming from different communities and even from the very big hospitals that we think are around us.
Mm-hmm. And if people aren't able to come here or they couldn't go to the clinic, what conditions would they have to give birth in at home, or in what area, and what dangers would they face?
Usually, home delivery is very common in Ghana, let me say. You may have, say, prenatal clinic coverage of about 80%, but only about 40% will come to the hospital to deliver. And most of the time they deliver in conditions that are not too appropriate for both mothers and babies. And so the children end up getting sick, mostly in the first week of their lives. And they may not know where to send them. They end up giving them some herbal preparations and all that, and that also worsens their situation. And so with this facility, we believe that a lot more education will go on, people will get to know the services we provide, and more babies are going to survive.
Awesome. Is there anything else that you would want to share with those in the United States about this facility?
Well, I believe that this facility is a turnkey facility that will change the lives of many children in the community and in Ghana. It is something that is going to help improve the health outcome of neonates, that is newly born babies, and especially for those who are born prematurely. And I would entreat or encourage each and everyone who can support to do so generously to make sure that we have this established in Ghana. Thank you.
Awesome.